Okay. Hello, my name is Don Kim, and this is my head to toe assessment. And this is my patient. Can you go ahead and introduce yourself, please?
My name is Danny Yi. I'm 26 years old, and I gave permission to Sound Kim to film the head to toe assessment.
Okay, so we're gonna go ahead and start. Hello, my name is Don Kim, and I will be your nurse for today. Can I go ahead and have your name and date of birth?
Danny Yi, November 18, 1996.
Okay, let me take a look at your armband, and all the information is correct. I'm gonna go ahead and perform my hand hygiene. Okay, so we're gonna go ahead and start with the general survey. I'm gonna go ahead and do your head to toe assessment, just letting you know. Yes, and we're gonna go ahead and start with the general survey. So I'm gonna go ahead and ask my patients a series of questions. And as he is answering, I'm gonna go ahead and assess his speech. Okay, and what is the month and year?
October 2023.
Good. And who is the current president of the United States?
Joe Biden.
Good. And where are you right now?
In the hospital getting a physical head to toe assessment.
All right, good job. So my patient was able to answer all of those questions correctly, and his speech is not slurred, and he had no difficulty forming his words. So we're gonna go ahead and look at his appearance. His appearance is nice and clean. Hair is clean. We're looking at his tidiness. He is wearing the appropriate attire for the weather. Looking at his weight, we don't notice any underweight. And he's not overweight either, so he's at a good normal weight. Looking at his behavior, he is not moody, he's not angry, he doesn't look like he's in distress or angry, so that's good. Looking at his skin, I don't notice any redness to indicate fever, any bluish tint to indicate cyanosis, any yellow tends to indicate jaundice. And looking at his posture is nice and erect. He's not in a tripod position to indicate that he has difficulty breathing, and he's also not guarding his stomach to indicate any pain in his abdomen. And then looking at his gait, can you go ahead and have walk around me just to assess your gait? Okay, good job. That's how you sit. Okay, so his gait is good. He did not have any issues walking. His balance is normal as well. He did not look like he's in any distress or pain as he is walking. He's not limping. Now we're going to go ahead and assess his vitals, starting with the heart rate. I'm going to go ahead and count his heartbeat on his radial pulse on both sides. I'm going to count for 60 seconds. And in 1 minute, I should be counting 60 to 100 beats. And it's both nice and strong, so 2+ bilaterally. Okay, now we're gonna go ahead and assess his temperature. We gotta make sure that the patient did not eat or drink anything for the last 20 minutes. I'm gonna go ahead and do an oral temperature, put the oral temp probe under his tongue onto the side, and it should be 97 to 100 degrees. Now we're gonna go ahead and look at respiration. So I'm not gonna let the patient know that I'm counting respiration, but I'm just gonna go ahead and observe. And I should be counting 12 to 20 respirations per minute. Now we're gonna go ahead and do his blood pressure. I'm gonna have my patient sit up straight, no crossing his legs, put the blood pressure cuff, which should be the appropriate size for his arm. And then I'm gonna go ahead and inflate and listen for the Kirchhoff sound on his brachial artery as I deflate. And the first Kirchhoff sound should be the systolic, which should be 100 to 120, and the second Kirchhoff sound should be the last Kirchhoff sound should be the diastolic, which should be 60 to 80. And then I'm going to go ahead and ask my patient to give me his pain level, 1 being the least, 10 being the most. Where is your pain at? 1. Okay, so that's good. My patient is in the least amount of pain at the moment. Now we're going to go ahead and assess his skin, specifically his hands and nails. We're going to go ahead and take a look, looking for any lesions, any swelling, any redness, no cyanosis of his nail beds, any deformities that I can see. I don't see any. And then I'm gonna go ahead and look at his nail beds to see any clubbing, which could indicate COPD. I'm gonna go ahead and do capillary refill tests on both of his fingers. And his capillaries should refill less than 3 seconds. Any more than that would be an abnormality. Now we're gonna go ahead and look at his head and his face, looking at the size of his head, to see that his head is the appropriate size, not too big, not too small. Looking at his face that is symmetrical. And then I'm gonna go ahead and palpate his head. Gonna look for any lesions, any lumps, any swelling, and do not feel for any. And then I'm gonna go ahead and palpate his face. Starting with the TMJ, which is the temporal mandibular joint. I'm gonna have my patient open his mouth, and I should fit 3 fingers. Good. And then I'm gonna go ahead and palpate for his sinuses versus the frontal right above his eyebrows, and the maxillary right under his cheeks. Any tenderness?
No.
No, okay. Any tenderness could indicate a sinus infection. And then we're gonna go ahead and test his facial expressions, which is going to test for his cranial nerves 3, 4, and 7. Okay, go ahead and lift up your eyebrows. Okay, go ahead and smile. Frown. Okay, go ahead and puff up your cheeks. Okay, any reactions to any resistance? That's good. So my patient was able to perform all of these expressions without any difficulties, which indicates that his cranial nerves 3, 4, and 7 are working, were functioning well. And then we're gonna go ahead and inspect his eyes. Looking at his eyes is nice and symmetrical, aligned appropriately on his face. We're gonna go ahead and inspect his conjunctiva. I'm gonna pull down his lower lid and you look up. I'm gonna look at his conjunctiva, which should be nice pink and moist, no discharge, no bleeding. Gonna go ahead and assess his sclera, look down, and his sclera should be nice and white. Again, no redness. Okay, and then I'm gonna go ahead and assess for Perla now. So with my light, I'm gonna assess his pupils on both sides, which are nice and equal and round. And we're gonna go ahead and do the corneal light reflex. I'm gonna go ahead and cover one eye and shine my light onto one eye. And the other eye, shine my light to the eyes. And the light should reflect on equal positions on both eyes. Now we're gonna test for accommodation. So I'm gonna have my patient look straight. Okay, and my light is shining. As I go closer, I should see my patient's pupil constricting. And as I go further, my patient's eyes should dilate. Same thing on the other side, should constrict as I go forward. Further away, I should see the pupils dilate. So my patient has good accommodation. Now we're gonna go ahead and do the confrontation test, which is testing for cranial nerves 2. It's gonna be testing for his peripheral vision. So I'm gonna have my patient cover this eye. Same thing for me. And just let me know when I bring my finger forward when you can see it, okay?
No.
Good.
No.
Okay, do the other side.
No.
The other side.
No.
Okay, good. So my patient was able to have good peripheral vision so that his cranial nerves 2 are working properly. And then now we're gonna assess the 6 cardinal positions of gaze. So I'm gonna have my pen light and my patient is gonna follow in different directions, following the pen light, following the pen. So, and as I'm doing this, I'm just going to assess any difficulties following the pen direction and looking for any nystagmus, which is fast oscillations of the eye, which I don't see any. So my patient has good cranial nerves 3, 4, and 6, and no presence of nystagmus. Then I'm gonna go ahead and look at his ears. So looking at his ears, are they aligned correctly on his face and on his head? Yes, and they're equal and nice and symmetrical. Looking at the skin of his external ears, no lesions, no swelling, no lumps on both sides. Good. Okay. And I'm gonna go ahead and palpate the outside of his ears. No any tenderness.
No.
Okay, same thing on the other side. No tenderness.
No.
Okay, good. And then I'm just gonna pretend my pen light is an otoscope, and I'm gonna go ahead and assess the internal structures of his ears. So because he is age 2 and above, I'm gonna go ahead and pull up the pinna and out. Gonna go ahead and assess the tympanic membrane, and on his right ear, I should be able to see the cone of light on at 5 o'clock. And same thing, pull up and out, and I should be able to see the cone of light at 7 o'clock on his left ear. Okay, now we're gonna go ahead and do the whisper test. So I'm gonna go ahead and pull down on the tragus and whisper something into my patient's ear, and he should be able to repeat.
1, 2, 3.
Same thing on the other side.
4, 5, 6.
Okay, so my patient was able to repeat it correctly. So he has a good positive, he's able to hear high frequency sounds. Now I'm gonna go ahead and inspect the nose. Looking at the nose, again, we're looking at symmetry. It's not more protruding on one side to the other. I don't see any lesions, no swelling, no redness of his nose. And then I'm gonna go ahead and take my light, go ahead and lift up your head. I'm gonna look at the internal structures of his nose. I'm gonna look for any deviated septum, which could be obstructing his airway. I do not see any. And then we're gonna do the patency test. I'm gonna have you hold down on one side of the nostril and breathe in through the other one. Okay, same thing on the other side. Okay, good. My patient has a good airflow in each of the nostrils, indicating that he does not have any obstructions or difficulty breathing. Now we're gonna go ahead and assess the mouth. Again, we're gonna inspect for symmetry of his mouth. Okay, no swelling, no lesions of his mouth. We're gonna assess the colors, nice and pink. Redness could indicate ketoacidosis. Paleness of the lips could indicate anemia. Blue indicates cyanosis. And then we're gonna go ahead and look at any cracks or lesions on the lip, which I did not see, that could indicate dehydration. Now I'm gonna look at inside of the mouth. Go ahead and open up for me, and looking at the lining of the mouth, the size of the buccal membrane is nice, pink and moist. And go ahead and stick out your tongue for me and say ah. Okay. And I should be able to see when he sticks out his tongue, I should be able to see the uvula, not the uvula, the tonsils are separate. They're not touching each other. They're not touching the uvula. And as he says ah, I should see the uvula rise up. So that's testing for cranial nerves, 9 and 10. And then we're gonna go ahead and have you stick out your tongue, looking at the tongue. It should be nice, pink and moist, no lesions, bumps, or swelling. And you go ahead and move your tongue up and down and side to side. Good job. So my patient was able to have good mobility on his tongue, which tests the cranial nerves 12. And then we're gonna go ahead and look at the neck now. Go ahead and lift up your head. We're gonna go ahead and look at the trachea first. Looking at the symmetry of the trachea, it's not protruding to one side or the other, it's exactly in the middle. And we're gonna go ahead and palpate the lymph nodes. So starting from the back, I'm gonna do the occipital. Any tenderness? No. Preauricular is right in front of his ears. Any tenderness? Postauricular below, behind your ears. Any tenderness?
No.
Carotid? Any tenderness? Submandibular? Any tenderness? Submental? Any tenderness? Tonsillar? Any tenderness? Cervical, superficial cervical?
No.
Okay. Posterior cervical? Any tenderness?
No.
Deep cervical? Any tenderness?
No.
Okay, and supraclavicular, any tenderness? Okay, so my patient did not have any tenderness, which indicates that he does not have an inflamed lymph node. Okay, and now I'm gonna go ahead and move to the back, and I'm gonna palpate his trachea. Okay, I'm gonna lift up your head. I'm gonna go ahead and palpate his trachea. I'm gonna move it to one side, palpate, look for any lumps. Move it to the other side, palpate, look for any lumps. He did not have any. I'm gonna go ahead and palpate the carotid. Okay, check the pulse. It's nice and strong, 2+. And then I'm gonna try to palpate for the thyroid gland. I should not be able to palpate the thyroid gland if I if I were to feel the thyroid gland, that means it's swollen. And now I'm gonna go ahead and also take for any bruits. Okay, go ahead and lift up. Okay. And I should not be hearing any whooshing sound, which could indicate that there are fluids. Okay. Okay. And I also, when I'm palpating the thyroid, I'm gonna have my patient swallow. Good. Okay, so I'm not able to palpate the thyroids. Okay, so now we're gonna go ahead and test for range of motion and strength of his head and neck. So I'm gonna have my patient resist me as he is flexing and extending his neck. Go ahead and resist me as you pull up. Okay, resist me as you pull down. Good job. To the side, to the other side. Touch your shoulders and the other shoulders. Go ahead and stroke up. Okay, good job. So my patient has good range of motion and strong muscular strength as when he is resisting, so it's 5+. And shrugging his shoulders are indicating that he has good cranial nerve 11. Okay, so now I'm gonna have my patient sit with his back towards me. Okay, so I'm gonna go ahead and inspect the posterior part of his thoracic cage. No lesions, no bump. It's symmetrical on his thoracic cage. I'm gonna go ahead and do the symmetrical expansion test. Okay, breathe in. Okay, breathe out. Okay, and as he breathes in and breathes out, the thoracic cage should be expanding equally and symmetrically. Okay, and then we're gonna go ahead and test for the tactile firmness. So I should be able to feel a soft vibration with the ulnar part of my palm. So as you say 99. Good. So soft vibrations are within normal range. If it's low vibration, it could indicate obstruction. Strong vibration can indicate consolidation. Okay, now we're gonna go ahead and percuss. We should be hearing resonance sounds. Okay, good. And we're gonna go ahead and test for the diaphragmatic excursion. So we're gonna percuss and hear resonance sounds until we hit a dull sound. Okay, and let's go ahead and mark that. Okay. Oh, we're gonna do that when my patient is exhaling. Let's do that again. Exhaling, exhale, and hold it. Okay, now you're gonna go ahead and inhale and hold it. Okay, so the diaphragm is right about here. It should be 3 to 5 centimeters. So my patient has good diaphragmatic excursion. Okay, and then we're gonna go ahead and test for the costovertebral angle tenderness. So right on the left side where the costovertebral angle should be, I'm gonna go ahead and copy. Any tenderness there? Okay, so no tenderness. Any tenderness can indicate a kidney infection. Okay, now we're gonna go ahead and also tape his lung sound. Breathe in and out. Okay, very good. So his lungs are clear with no crackles or wheezing. And now we're gonna have my patient face forward for me, please. We're gonna go ahead and do the same thing on his anterior part. So again, we're gonna assess the front part of his chest. Go ahead and sit up straight. Okay, no for any lesions. Look for symmetry. He does have like tattoos, but I should be able to see that there are no lesions or swelling or bumps. Go ahead and sit up straight for me. Okay. And I'm gonna go ahead and do tactile parameters on the anterior part again. So 99.
99, 99, 99, 99, 99.
Good, nice soft vibrations. And then we're gonna go ahead and percuss. We're gonna hear resonant sounds. Good, and now I'm gonna go ahead and also tape. Go ahead and breathe in and out. Good, nice clear lung sounds, no truffles or wheezing. And now I'm gonna have my patient lay down. So I'm gonna lay down for me. Okay. So I'm gonna go ahead and inspect the heart system. First inspecting the precordium to see for any pulsations. If you were to see any pulsation, that could mean that the patient has a very fast heartbeat. I don't see any right now. Then I'm gonna go palpate for the apical pulse right on the left side in the fifth intercostal. I'm gonna go ahead and palpate, but it's best to palpate it when my patient's laying on the side. So I'm gonna have a patient lay on the side, and apical pulse is good, 2+, and now I'm gonna assess for thrills. So I'm gonna go ahead and take the palm of my hand and go ahead and place it right under the clavicle. Okay. And if I were to feel for any thrills, it could mean that there is an obstructed blood flow, and I do not feel for any thrills. And then I'm gonna go ahead and also take different points of the heart. So first point is going to be the aortic valve, which is on the right side in the second intercostal. So 1 and 2. I should be hearing S2 the loudest, normal rate and normal rhythm. Then we're going to go ahead and do the pulmonary valve, which is on the left in the second intercostal. And again, I should be hearing S2, normal rate and rhythm. Then we're going to go ahead and hear the Erb's point, which is going to be the third intercostal left of the sternum. And I should be hearing S1 and 2 equally, normal rate and rhythm. Then the tricuspid valve, which is on the left sternum, but on the fourth intercostal. So 1, 2, 3, 4. And I should be hearing S1 the loudest, normal rate and rhythm. And then the mitral valve is going to be right along the mid-clavicular line, which is in the fifth intercostal of the left side. So 1, 2, 3, 4, 5. Okay, and again, I should be hearing S1 the loudest, so normal rate and rhythm. Okay, and now I'm gonna look at his jugular vein. So we're gonna go ahead and pretend the patient's head is at 30 degrees. And I'm gonna have my patient turn his head towards me and looking at his right side of the jugular vein. And if my patient had a positive jugular vein distension, then I should be able to see and feel for a swollen jugular vein, which could indicate that my patient is having heart failure. And right now he does not have any. And then we're going to go ahead and do the abdomen. So I'm going to go ahead and inspect the abdomen again. I'm going to look at the contour. My patient has a very flat abdomen, which is normal. It should not be rounded. It could indicate ascites, or if it's concave, it can indicate that he is malnutrition. Then we're gonna go ahead and also tape first. We also tape first on the abdomen, so not to disrupt the bowel sounds. So I'll also tape first the aorta above the umbilical line. We're gonna check for Bruits. Okay, and I should be hearing any whooshing sound if there are Bruits present, and I do not. Then I'm gonna go ahead and move to the ileocecal valve. And when I also tape, I should be hearing 5 to 34 bowel sounds per minute. So I'm going to assess for 60 seconds, 5 to 34. I don't feel any. Go into the right lower quadrant, 5 to 34 bowel movements per minute. Going to the right upper quadrant, 5 to 34 bowel sounds per minute. Moving on to the left upper quadrant, 5 to 34 bowel sounds per minute, and then lower left quadrant, which is 5 to 34 bowel sounds per minute. Okay. And then we're gonna go ahead and percuss. So percussing the abdomen, I should hear a timpani sound. We're gonna go from right lower quadrant to the right upper to left upper abdomen to the left lower quadrant. Then we're gonna go ahead and percuss for the liver span. So we should be hearing resonance in the lungs and then a dull sounds that indicates the liver. Here, and then it's the same thing for the spleen, resonance in the lung field, and then right below should be a dull sound for the spleen. Okay, then we're gonna go ahead and palpate from light to deep, palpating light first, and starting with the right lower quadrant. Any tenderness?
No.
Okay, right upper quadrant, any tenderness? Left upper quadrant, any tenderness? And left lower quadrant, any tenderness? Okay, so there we're gonna go ahead and move on to the deep. So we're gonna use 2 hands. Left lower quadrant, right lower quadrant, any tenderness? Right upper quadrant, any tenderness? Left upper quadrant, any tenderness? And left lower quadrant, any tenderness? Good, so no tenderness in the abdomen. And then we're gonna go ahead and do the ductal movement to assess his kidneys. I'm gonna put my hand underneath his abdomen and then on top. And I'm gonna assess for his kidneys. I should feel soft. And then no hardness for the kidneys. And then we're gonna go ahead and do the poking method to assess the liver. So I'm gonna go on this right side. Sorry. So the hooking method, I'm gonna go ahead and go right under the thoracic cage. I'm gonna have my patient inhale. Okay, and I should feel the liver and then exhale. Okay, and I should feel the tip of the liver, the bottom part of the liver with my fingertips. And it's going to be the same thing for the spleen, but I should not be able to palpate the spleen. If I am able to palpate the spleen, that means the spleen is 3 times its size, and I should stop palpating immediately because it could rupture. Okay, now we're gonna go ahead and look at his lower extremities. I'm gonna move to the side so you guys can see. I'm gonna go ahead and look at his lower extremities. Again, we're gonna go ahead and inspect, make sure one leg is equal and symmetrical with the other leg. Looking at the skin and the distribution of hair, everything looks good. No swelling on one side more than the other, no lumps, no lesions. That's good. And then we're going to go ahead and assess the pulses. So starting with the popliteal pulse, right behind the knee. Okay. And then dorsalis pedis, which is on the anterior part of his foot, right above the big toe. Okay, and the tibia, which is right behind the ankle. Okay, so he has good pulses, and now we're gonna go ahead and assess for range of motion and muscle strength. So I'm gonna go ahead and have that patient flex his knee. Good job. Extend the knee. Good job. And go ahead and try to lift up your leg. Resist me. Okay, go ahead and try to lift up your leg and try to lower your leg, resist me. Good job. Same thing on the other side. Go ahead and flex your knee. Good. Extend it. Good. Go ahead and lift your knee. Resist me. Go ahead and push down. Good. Same thing with his feet. Go ahead and extend your feet. Good. And flex your feet. Okay, move it in circular motions. Good. Go ahead and try to resist me. Extend. Extend on both sides, flex on both sides. Good. So my patient has good range of motion and strong resistance. So he is +5. Now I'm going to go ahead and have my patient sit up for me. Go ahead and sit up. So we're going to do neurological testings. We're going to first do the sensation. So I'm going to go ahead and have my patient close his eyes. And I'm gonna go ahead and either touch him with the dull side or a sharp side. So he's gonna indicate which one.
Sharp. Dull. Sharp. Dull.
Good. And then I'm gonna go ahead and do the positional. So I'm gonna, with my finger, I'm gonna touch a specific part of his body with his eyes closed. He's gonna tell me which body part I touch, okay?
Right elbow. left shoulder, left knee, right shoulder.
Good, my patient was able to do, the sensation was correct and his position was all correct. Now I'm gonna go ahead and do finger to nose, so open your eyes for me, and you're gonna touch your nose and touch my finger in different directions, okay, here we go. Good. 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 Okay, so this is testing for his coordination, and he was able to do that without any difficulties. Then we're gonna go ahead and test the stereognosis. So I'm gonna have my patient close his eyes. And then I'm gonna go ahead and excuse me, I'm gonna go ahead and place an object in my patient's hand, and my patient should be able to identify it by the sensation of the object. So here we go.
And it's round, it's firm. I think it's chopstick.
Good job. So he was able to correctly identify the chops that I gave him without opening his eyes and just using his sensation. And then let's go ahead and test his deep tendon reflex. Okay, we're gonna first start with the brachioradial tendon. Okay. Job. Okay, biceps. Triceps. Okay, and his knees. His patellar, I mean. And then we're gonna do his Achilles. The other side. Good job. And then we're gonna go ahead and just assess his capillary refill on his knee, on his toes too. And that's also able to refill within 3 seconds. And then I'm gonna go ahead and have my patient stand. And then go ahead and have your left heel touch the opposite, yeah, knee and push down. Yes, do the other side. Good job. Okay, so my patient was able to do that without any difficulties. And then I'm gonna go ahead and do the Babinski wrist flex. So go ahead and sit down for me and lift up your feet. And I'm gonna go ahead and pull up. And my patient should have no Babinski reflex, which means that he should not curve his toes. His toes should be standing out. Okay, and then let's go ahead and test his musculoskeletal system. I'm gonna have my patient stand up and walk on his toes and then his heels. Good job, heels. Good job, and he has no loss of balance. He's able to walk properly. Then we're gonna go ahead and do the Romberg sign. I'm gonna have my patient close his eyes, and he's just gonna stand in position without any swaying, no loss of balance, no falling. So my patient was able to do that without any difficulties. Okay, so have a seat. This is the end of our head to toe assessment. Thank you so much for watching. Thank you so much to my patient for being such a good patient for me. Okay, and I hope you enjoy. Thank you.